So I teach in the health sciences department, with my two faculty mates here. I'm also the clinical education coordinator in our athletic training program. So I have a little offload to do that. And what I'm going to talk about today is how we've incorporated a bunch of kind of different ways of bringing ethics into the classroom, and how then we're also trying to really instill it and get our students to think about applying it, and how are they going to apply it in the real world when they leave here. So I wanted to start with, this is a bigger group, the question would be, does anybody know what an athletic trainer is? Because the term athletic trainer does not really describe our role very well. It sounds like you train athletes. And I'll tell you up front, it's not what we do. Yeah. So athletic trainers are healthcare providers. They are recognized by the American Medical Association. So athletic trainers are allied healthcare professionals that are recognized by the American Medical Association. So this definition is coming straight from our National Athletic Trainers Association website. So the National Athletic Trainers Association is our overarching kind of body that helps with regulation and identification of who we are, what and what we should be doing. So we're multi-skilled healthcare professionals who provide services and treatments to the physically active. So we don't train athletes, we take care of them. And there's multiple components in that. First of all, we work in collaboration, under the direction of, or in collaboration with a physician. So that is a regulation that is across all states. And we, of course, work within accordance to our education, our training, and the state or federal laws and regulations. So having said that, 49 states have regulation of athletic training. One state does not. California does not have regulation yet. We're working on it. So there's some requirements and ethical considerations that we have to follow just to practice, or we could lose our license. So we have to follow those rules. What do? What defines us? That's what I have here in bold. We provide prevention services for primary care kind of illnesses and injuries. We provide wellness promotion and education. So just keeping your body healthy, and what is it you're supposed to be doing to be able to do the things that you want to do. We provide emergency care when things happen. We provide examination and clinical diagnosis of injuries and illnesses. Then we provide therapeutic care for those injuries and illnesses. So if you get hurt, now what? We decide what needs to be done and apply those services. So stretching, ultrasound, heat, ice, rehab programs. We write rehab programs. That's another component for all these injuries and illnesses. Also, we are obligated to follow the NATA Code of Ethics. And I'm going to go into all of these. So as we think about all that, there's a whole lot of areas that ethical considerations can fall into, whether it's the services, the care, or it's the organizational components of being an athletic trainer, or the legal ramifications of being an athletic trainer. Those are just kind of some subsets. So for those of you that aren't as familiar with athletic training, when something happens on the field of play, a football game, a soccer game, a volleyball game, somebody usually goes out on the court or the field to help figure out what's going on. I think that the general public still thinks that 90% of the time, they think that that is a position. It's not. 90% of the time, it's an athletic trainer. And we're the one that's running out there to figure out what's going on. This is a picture from the game, the football game between the Buffalo Bills and the Cincinnati Bengals on January 2nd, 2023, when Damar Hamlin was hit in the chest, stood up, and immediately fell backwards and went into cardiac arrest. The first person that was on the field of play to get to him and assess him was an athletic trainer for the team, employed by the team. He assessed it, activated their emergency action plan, got the other medical providers there, and then they did what they needed to do to try and save his life and get him shipped off to the services that he needed for higher level care. So that's kind of like the big picture of being in the media of athletic training, but there's a whole lot behind the scenes that athletic trainers do and have to be considerate of a variety of ethical things. So if we think about where are these areas, and as I was trying to put together, like, what do I want to do? So today I'm going to talk about what I did for my project and where I want it to go in the future and how we can make it better and be improving on getting our students to have these ethical considerations so they're ready and prepared when they go to the field. So some of the things that I was thinking about was sports medicine ethical considerations. You talked about there's the sport, right? There's ethics within sport. There's ethics within medicine. There's ethics within organization and business. So sport is a business, and we're just the healthcare providers within that business. So there's all these layers of ethical considerations, and I just listed a few things here that came to my mind. So just the roles and responsibilities of an AT. What is it you're supposed to do? How do you stay in your lane? How do you expand yourself and continue to be, you know, advanced and educated, but not stepping on the toes of other individuals? How do you stay within your role? Medical assessment process and diagnosis. So just getting people to the services that they deserve. So those social determinants of health. What do you have access to? Does everybody have access to it? And if you're the provider, are you ensuring that you're doing everything you can to give people access? Performance services versus diagnostic care services. Where my head went here is everybody knows that an athletic trainer is going to evaluate and take care of injuries. But athletic trainers are also involved in performance services. They're a key component to a team. They are there just as much as a coach is, if not more. So athletic trainers show up an hour to 2 hours before practices start, take care of all the things for practice and getting all the athletes ready, take care of the athletes at practice, and then take care of everything afterwards. Within a lot of that, it's not necessary injury diagnosis and management. Sometimes it's doing the recovery massage and the recovery work and having conversations about nutrition and all of those other pieces, having conversations about medication and doping concerns. So that's kind of all the performance side that goes into it as well. AT individual as part of a larger interprofessional team. We work with, as I said, under the direction of physicians, but also side by side, if you have the opportunity, with physical therapists, with massage therapists, with chiropractors, all working together to provide the best services for a team or an athlete. Making sure we're still providing patient-centered care. It's all about the patient, it's not about you. And implementing respect and trust with our patients. And then, of course, leadership and organization administration. So what I wanted to do is think about going from the classroom and getting all this content about ethics out into the field of play. And so when I thought about, well, how are we currently doing that? Well, we're doing it in all these areas of what we teach about: prevention, assessment, care and management, organ admin, and interprofessional practice. We are weaving it in and out of there all the time already. Those are the things that we have to teach in our curriculum. So right now our MSAT program is CATIE, which is the accrediting body, accredited program. Students have to go through a CATIE accredited program to be able to sit for their national boards. And if they pass their national boards and they graduate from a CATIE accredited program and do a couple other things, then they are certified and they can practice as an athletic trainer. And then they can get their license or registration at whatever state they're in to practice. So very similar to PT, AT, PA, all of that, right? So there's certain things we have to teach, and these are some of those things that we have to teach, and it's easy to implement maybe some ethical considerations within those. Also, students are required to complete clinical rotations. They have to do that. That's part of the CATIE accreditation requirement. In our program, we start students on their clinical rotations very first semester. They take a 1 week emergency course, and then we say, you're going to clinicals and you're going to start helping. The emergency course is so when they get to their clinicals, they know how to help and not be a hindrance at clinicals, and that they're diving in right away. But again, think about the ethical considerations there too. Staying in your lane, doing what you know to do and not overstepping, and watching what's going on around you.
Where are the clinicals?
We have clinical sites at high schools in the Colorado Springs area, at UCCS, at some of the colleges in the Colorado Springs area. And then for our bigger clinical rotations, which are in the 4th semester, they can go anywhere in the country. Primarily right now, we've stayed in kind of Colorado and
Yeah.
Wyoming, so,
Neat.
or North Dakota, South Dakota, yeah. Okay, so going from, whew,
No,
There you go.
there it is.
all of them, going from the classroom, so this bottom left
Wow.
one is that first week of classes, learning how to do some of the basic skills. This is not rocket science, but it's basic skills,
Is
right?
that safe for them to be on the counter?
Yes, but it's specifically for that. It's built, it's a taping table, it's a taping station. So those are our students, it's our students learning how to do emergency care, right away. Learning how to do prevention care, so fitting equipment for prevention services. And then getting into their clinical rotations, hopefully.
There you go.
Top left and over
Yeah.
here on the right, doing their actual, this is our athletic training student, this is our athletic training student, still in school,
Mhm.
to hopefully finally someday practicing like this. So this
Oh, wow.
is 2 very seasoned athletic trainers working at the Pikes Peak Bus Rodeo. Dr. Elder works at the Pikes Peak
I
Bus
never
Rodeo.
thought about the
sometimes help
rodeo.
them. Yeah, so if you go to the rodeo this summer, and if we're working, they'll announce our names. But working at the Pikes Peak Bus Rodeo, going into practice. And trust me, there's a lot of ethical considerations when we're working there, just about how to care for people,
Mhm.
So I want to get our students from here, the first week, to their 2nd, 3rd semester, to their 4th semester, and then out here to comfortably be able to practice with good ethical considerations. We all do. And so we're working really hard on implementing that. We recognize that there's an overlap of principles of our NATA Code of Ethics, our MSAT core values, I'll go over those, our athletic training shared professional values, and the Daniel Fund initiative principles. There's a lot of overlap in the same concepts in all these ethical principles. We also recognize that students have a hard time trying to think of outside of like, just do this. They want the answer, right? And we're like, no, you need to think in the gray zone. You need to critically process, critically think. And they get really flustered, don't they? When they ask us a question about, well, what do I do if blah, blah, blah? And I probably think all 3 of us stand up there and go, well, it depends. And they say, that's not the answer I was looking for, right? But we're trying to get them to process, think, go back to your foundational ethical principles. So what are ours? When we designed designed the athletic training program, we first sat down and said, who are we? Who do we want to be? What do we want to make this about? What do we think makes a great athletic trainer? And how do we get what do we need our students to buy into to get to that end product? And so we came up with 5: empathy, humility, integrity, respect, and zeal. You've got to have excitement for what you're doing. Okay, so you can already see a little bit of overlap here with what the Daniels Fund ethical initiatives are. The NATA Code of Ethics talks about very similar concepts.
Yeah, you have to point. It's
Okay.
kind of like the TV.
That first, athlete trainers need to practice with compassion and respect for others. Second, you need to comply with the laws and regulations. Rule of law, intent of the rule of law. Third, you should maintain and promote high standards of your professional services. So continuing to try and be better and grow. And always do what's right and best, right? And then members shall not engage in conduct that could be construed as a conflict of interest, reflects negatively on the profession, or jeopardizes a patient's health or well-being. Their shared professional values are care, compassion, integrity, respect, and competence. Okay, so again, a lot of overlap. And of course, accountability. Say what you're gonna do and do what you're gonna say, or do what you say you did, so, okay? If we compare that to our Daniel Fund ethics initiatives, they really align up very nicely. So this is not just about business, that's what you were talking about
Yeah.
before. It's not just business, it goes into these other areas. And what I love about athletic training is it's sport, it's medicine, and it's business.
Mhm.
So thinking about our students, our goal is to get them through this graduate level program in 2 years. We have to. And it used to be that athletic training curriculums were housed in an undergrad program. And programs could take up to 4 years to get somebody through a program. And they can deliver all of the content over that 4 years. Most probably did it in 3, right? 2.5 to 3. Well, now all programs have to do it in the minimum of 2 years, however many semesters you want. We do it in 4 semesters. So we are cramming a whole lot of information and a whole lot of experience on our graduate students in 4 semesters. We want them to be able and prepared to work autonomously in a professional setting of their choice. So that professional setting could be independent, like I'm working at a high school all by myself, or it could be collaborative, where they're perhaps working at a university or a professional sports team with a whole bunch of other providers. So depending upon what you're going to in 2 years, you could just be thrown out there and you can either be swimming nicely along because you got a good support system with you, or you're floundering and trying not to sink, right? So we want them to be prepared to swim regardless if they're independent or collaborative. The challenges we have, our students, of course, are coming in with limited life experiences. So they don't know what they don't know. And then you give them these situations of this gray thinking and ethical considerations, not quite sure how to process it, and they get a little flustered, right? Some of them. A lot of these grad students are still thinking in absolutes, good, bad, right, wrong, black, white, right? So they're not thinking about like the what ifs. It depends. Some of our students I am seeing have some avoidance issues. So if that feels uncomfortable in my clinical rotation, and I'm not going to involve myself. I'm going to let the preceptor take care of all that, and I'm just going to stay clear. We're trying to push them into that space so they have those exposures and experiences, so they learn how to navigate it in a safe, controlled, supervised environment. Emotional intelligence, of course, we all are better at that than others. I'm still growing there. Group dynamics, so dependent upon the cohort and dependent upon where they're doing their clinical rotations, can affect kind of just their experiences and their ethical considerations. And then of course I said we are really compressed into a 2-year timeline of trying to get this done. So teaching all the skills, all the knowledge, everything you need to know about sports medicine and all these non-tangibles as well in 2 years. So we weave stuff intentionally into our courses. So these are some of the main areas that we are really doing ethical principles and considerations woven into our courses. And we're doing an accreditation review right now on the self-studies. We've really been talking about this a lot. Where are we doing this? But we have 3 semesters of courses where students are learning about injury diagnosis and management, and they get a case that we write up. They get 3 cases a semester that we write up. It's a hypothetical case, and it has a lot of demographic information with it. And sometimes we'll throw in a kind of an ethical issue into the case that goes along with the orthopedic injury that they got to write a care plan for. So they got to talk and think about all of that. And that's a written assignment, they write it down. There's a leadership projects that they do, and that's kind of an interprofessional education project, and that may have some ethical considerations in the community projects that they're doing. We also have high fidelity simulations and standardized patients where we actually have either this mannequin that can do everything and is in an emergency scenario, and we kind of set it up with all, again, these demographics and background information, maybe on religion or social determinants of health or health literacy or things like that. And then an emergency happens and our students have to respond to that. And then we have standardized patients, kind of similar, but that's just with a live person. So we're getting closer to the real life stuff, but this is a very controlled setting. If they need to take a timeout, they can say, stop, timeout, I need to recruit. We know that doesn't happen in the real world, right? So, but it gives them an opportunity. And then in their clinical rotations, they have cases. They take care of things, and they have to write up the evidence-based reflections, where they go through the case and they identify everything that they did on the case for the evaluation, the care, the follow-up, the discharge, all the kind of the background on the patient. Then they have to look at the evidence that says, what should I have done for all these components? And then they reflect on, or the evidence says what you should do. And then they reflect on, did I do it? Would I change anything for the future? What would I continue to do? Okay, so these are all kind of passive. Want to do something a little bit more active. And so this year I decided to implement a case competition based off of what your guys have already been doing with these bigger case competitions. Like, well, let's put it into sports med. So we started that this semester. And so what my objectives were to demonstrate ethics-based decision-making in common clinical practice scenario situations. Model all those principles that I've already talked about. The VOC standards of professional practice are direction, prevention, immediate care, evaluation, diagnosis, therapeutic intervention, and program discontinuation, and organ admin. And then we got patient care, competency, and professional responsibility. So these two were the ones that I was like, oh, this will fit really nicely here as a case competition. So I sat down and I said, I have to figure out where am I going to get these cases from? They need to be real. They need to be not made up. So I've been in practice for 30 some years as an athletic trainer. I worked a little bit in a clinic, and then I worked at a college, and then I worked at the U.S. Olympic Committee for 20 years. And then I came here, and I've been here 10 years. I've been doing some camps and PRN work. So I've had quite a few exposures to quite a few ethical issues, from basic level children's sports to the best in the world. So I thought, what can I pull from that? What can I pull from my colleagues that we have sat down and talked about things, and how do you manage this, and been on the phone with people about how do we manage this? I just brainstormed. I just started writing stuff down. I looked and I followed different social media groups, at night, just scrolling through. But women in athletic training, or young professionals, or the athletic training educators digest, those types of things, and just see what people are talking about. What's going on out there right now that people are struggling with? Because on those social media groups, they're not talking about how to evaluate an injury. They're talking about these non-tangibles, these HR issues, these I hate my life issues right now, those types of things.
Someone's calling you.
No one ever calls. So I looked through that, and then examples from what our students have been sharing in their journaling. I have them do journals, and sometimes they'll share like, this happened, I don't know what to think about it. And so it's really just trying to pull all that together and think about, how can I make a case out of that? So I made a case. This is my case. I don't have it as for you guys at home. I'm sorry, I don't have it as a.
We'll make sure.
You guys. know this.
Here's the case. We'll make sure you get a copy. By the way, we have our case competition here in November 2nd.
Yep, I saw
And
that.
we have a graduate track.
Yeah,
And I'm always looking for something that's relevant, so we usually get a bigger case.
yeah.
But not too big, but yeah, so.
So this case, I've made multiple kind of components to it. But before I get there, how am I gonna run this? What might be different? So our cohorts, we have a first year and a second year cohort, and they don't have a lot of opportunity to work together. We meet once a month, 3 times in the fall and 3 times in the spring. So October, November, December, February, March, and April. We meet once a month on the second Monday of the month, where the students can all get together and chit chat about what's going well, what's been a challenge, share. The second years can share more with the first years, talk about different things. Then we usually have a guest speaker, or we do something so that they just have time together. Otherwise they don't. So I'm like, okay, I'm gonna blend the teams. So I split it where we had 12 people in our total 2 cohorts. So I did 2 on the first year, 2 on the second year, put them on team. And then I presented them with this scenario that you have, and I presented it 2 months in advance of when they needed to do their presentation for the case competition. and talk to them about all of the principles again, because we teach all these principles, the code of ethics, the Dan Hill's initiative, ethics initiatives, we teach all that in our foundation courses. So I presented it to them again, reminded them, these are the things that I want you to think about. There isn't necessarily a right answer. Go find what you think is the best answer, figure this out. And then encourage them to discuss this with their preceptors, the people that are out in the world that have probably had these things happen, because these are real cases. And then I thought, we got to get judges. So I had to recruit judges. Just like you do here at the business school, I wanted to have people from the community. So we said, well, let's use our preceptors. Great idea, right? They're going to totally want to do it. Going back to this. When I put this whole thing together and put it on the calendar, it's going to be April 8th. Well, April 8th is the second Monday of the month in April. It also happens to be when the men's NCAA Division I basketball finals were. Final game. It's the final game. And I was like, oh, shoot. How are we gonna get any athletic trainers to leave their TV to come do this? I found one. And then the rest of the judges were us.
Yeah.
So next year, that's gonna be a little different. We found some people. So the case, you just read the case. Multiple things going on, morale issues, policy and procedures that need to be updated, inconsistency of how services are being delivered, issues with coaches having inconsistencies with that. So kind of just like a little bit of a mess going on. And that can happen. And so the head AT says, let's fix this. I'm going to make you a committee. So that was my team. Those were those teams. They were the committee. And they needed to address those things going on. So this is on the handout that you have here. All of their tasks were to convey in-depth understanding, identify the issues, stakeholders, and the ethical and health and legal considerations, demonstrate the core values and all of the ethical principles, offer actionable and doable recommendations. Actionable and doable. And provide those recommendations being ethically sound and legal, okay? So, because what we've learned, or what I saw in some of our other students' presentations of different things was like, that's a great idea, but can you actually even implement that? Where are you gonna get the money for that? Where are you gonna get the time for that? Like, really think this through. So, we did it. We ran the cases. We had 3 groups of students. They presented on that night. And we had some real successes. And this is my interpretation of this, what I think were the successes. Students told me it felt realistic. It woke me up like, oh, our students that are graduating this May, there were more than one of them that said to me, I thought, oh, wow, this could be me having to make these decisions in 2 months. I don't know if I'm ready to do that, but I got to get ready. They said that it helped them feel more prepared in that process because they hadn't really thought of things that way before. And it made them think critically because they wanted to not navigate the gray. They told me that they looked things up online and they couldn't find the answers to kind of the questions that are posed in here. And I said, well, what did you do with that? And they said, well, first I was like, well, blankety blank, what am I going to do with that? And then they said, they just kind of took a breath and had to think about it and calm down and just navigated it and talked to their preceptors. So it made them engage more on a different level with their preceptors, not talking about how to evaluate a need, but this organ admin stuff that they don't really necessarily do a lot at their clinical sites. We want them to, so it kind of forced that to happen. And obviously then we got good collaboration between the second years and the first years, and it made them work together when they really don't have opportunities to work together. The issues were the timing, 2 things. So not only the NCAA championships, but our students take their board exams typically in March. So a bunch of them kept telling me that this is totally at the wrong time. We're trying to study for our national boards. And so then I said, well, how much time did you, once you got going, once you got started, they said they had a really hard time getting started. Once you got started, how much time did you have to put into it? And it was immediately this posturing to, this posturing of really kind of only a few hours it really took. I was like, see, this is why I gave it to you in January, so you could start just making some outlines and getting working at it. And it didn't need to be so overwhelming. So that's something I've learned on how to present, I think, the concept earlier. So these are all workable in my mind. The successes were really worth it because they really felt that it was helpful. Opportunities are thinking that maybe I can have students come up with more ideas in another semester to just start sprinkling those ideas at me so I can develop out more scenarios and have that be some sort of an assignment somehow. I want to grow this with other athletic training programs that are in our state. There's 4 in the state, us, University of Northern Colorado, Colorado State, CSU Pueblo, and then Colorado Mesa. For IPE opportunities between maybe us and social work, us and nutrition, us.
Business, we have a sport management program.
Sports management. I think that would be cool as an opportunity to build cases and work together. And then more sports medicine community involvement.
Yeah.
And so what I mean there is obviously not just our preceptors, but I would like to get as the judges, maybe the AD, maybe the associate AD, maybe a coach, depending upon the scenario, as being judges for this, because I think it'll just really help all of us understand each other better, and provide some different insight to our students. So
That's pretty cool.
So long-term plan, going to keep it as an annual assignment. Every spring, we're going to do it. Like it or not, they're going to do it. March is going to be March, and this is not that overwhelming. But it primarily because
Look at the sports schedule when you plan it.
Yes, for sure. Promote collaboration. And so I think that was the big positive out of it. It really promotes it. And those 4th semester students are getting ready to go somewhere. And I think it's going to be more impactful for them. And then they can mentor. And as we keep doing it every year, it's just going to get better and better. And then have this be a case competition, potentially virtually first between at least ours and another state program. And then maybe someday we can get it to our state athletic training conference, our Colorado Athletic Trainers Association conference, and have it be an event there that athletic trainers from all over the state, we can pick as judges, some of them, and they can judge this and pick a winning team. And then maybe onto the district level. And our district athletic trainers district is Colorado, New Mexico, Arizona, Utah, and Wyoming. So cool. There's programs in each one of those states as well. So we could see who won. This is way down the road.
Yeah.
But I think that would be a cool opportunity.